The first one is from Minchao Nguyen. He asks, is there a standalone viable sanitation model?
When we think about our sanitation marketing model, I saw somebody had the 5 A's the 4 A's of social marketing before. Those really kind of rang true with me. I'm trying the affordable, available, accessible, aware. We think when we think about our sanitation marketing model, we think about something similar, which is, are the products desirable? Are people going to be willing to buy them? Are they viable? So that viability, I think, I'm not sure if that gets to the standalone part of the question asker's question, but can businesses and individuals make money by selling these products and services? And then are they technically feasible? So those are the three that we think about: desirable, viable, and feasible. Happy to answer that question maybe a little more clearly if I can just get a little more detail.
Can you hear me?
Yes, we can hear you very well.
Yeah, my question, because I've done a lot of work on it, and it's sanitation business is very difficult to be viable. So normally the producer has what they call bundling services. They sell products, materials alongside with, for construction, or they do installations, or they do some other thing that has nothing to do with sanitation in order to be able to survive. And normally selling latrines for this viable business is a very small portion of their business. So my question related to that, the business margin that you show there, is it just for selling latrines, or is it the margin for the whole business, which also including some other material services, etc.? Is that
great question? Thank you for clearing that up, Ming Chao. Yeah, so the data that I showed you is just for the sale of latrines, so that doesn't include. I think you're right that, and as I mentioned, I think a lot of the latrine producers that we work with, excuse me, have established businesses. They have other lines of business that they're involved in. But what I showed you is just the sanitation portion of what they're doing. And I don't know. I mean, I think potentially the jury is still out on whether there's a standalone in the rural context, especially if there's a standalone viable business model for sanitation. I think some of the work that our Cambodia program is doing so just for instance, they've rolled out a shelter product. So in addition to the substructure of the latrine, also selling a solid shelter product that has pretty significant margins associated with it, and having that as an option for latrine producers.
Sorry, I don't mean to monopolize, but just quickly, if you read the HISTRA report, if you read the HISTRA report that talk about rural marketing, rural sanitation program, it clearly says that just selling the underground and just doing it's just not a viable business. So they need a very high margin type of business to go along with selling latrines. So I'm just throwing out there. I think if you look into HISTRA website, you see that report, and I think you are part of that study too, IDE.
Yeah, and I think you're right, and that's where this sort of experimentation with higher margin products like these shelters comes into play. I mean, I think the Cambodia team would be the first to say, we're kind of in the testing phase. We're in very few communities with those shelter products, but I think they're working towards the same kind of issues that you're talking about.
Simon, can you hear as well?
Yeah, sure. I can hear you. Can you hear me?
Yeah, I'm just going to ask one of the questions that was directed to you, Simon, from Molly Goodwin-Kunchitsky. How are you targeting tenants differently from non-tenant households?
Non-tenant households, we within the towns that we've focused on, we've had the two different situations. We've had, for example, Nakuru town that has lots of absentee landlords, meaning that the tenants stay there by themselves or under the care of some caretaker, and in that situation, then the approach is to actually inspire the households, the tenants, to demand for sanitation facilities, improved sanitation facilities from their landlords, and this they could do through the agents or the caretakers of this, these plots. So the animator, the social marketer, would go to the households, and that's, as I did say earlier, it's one-on-one communication with each and every household, and then ask questions as to what are the what kind of facilities they are accessing at the moment, the challenges they are facing, and how they can approach the landlord. And then with that, the caretakers then are able to communicate with the landlords. But here you would find that what comes to be a very important component is the inclusion of the public health department. So the animators would come with a carrot, that is saying the beauty of having improved sanitation, saying the incentives available for, constructing a toilet, telling you about availability of artisans to do the work for you. But then the public health officer would then also demand, and that's where now the stick comes in, that, everybody has a right to access improved sanitation. And this then throws the households into demanding this from the landlords. Now, the same particularly apply for non-tenant households, the households that are purely owned by the occupants, and so we would go the same way. And here, what they see, there is value proposition when you tell them to have improved sanitation which they can access with their families. There is also the element of permanency. So they will see this as a long-term intervention for their families. So they really, the question of bringing on board even the public health officials to actually kind of, threaten these households is not there, because they outrightly see the value of investing in sanitation, and so for their family, for that matter. The tenants themselves don't see this long-term, this long-term benefit, because at one point they can move to another, another plot where they are improved facilities, or where they will actually start all over again to advocate for improved facilities.
Okay,
Yeah.
thank you. Which brings me to one more question that was asked by Sanjay Gupta, directed to you, Simon. What is the role of policy makers from government if this was private sector driven marketing strategy for sanitation services?
Well, I'll try to answer the second bit, but I'll start with the first one. In the Kenyan context, policy with regard to sanitation has been a little bit disintegrated. You'd find various acts of parliament resting with different ministries or different departments that are taking. So basically bringing these separate acts of parliament touching on solid waste management, touching on health issues, touching on pollution, you have to really bring different bodies together for us to come up with a concrete concept around, promoting a particular sanitation technology or approach. And so their role would then be, one, looking back into their particular policies and strategies and see if they're in harmony. And I believe what we've learned over time, over the 6 years, is that most of these sometimes fail to be in harmony. And our role then is to advocate and influence upward to see that the bottlenecks created by a particular act of parliament in a particular ministry is then reviewed. And one big output of what we did in ABSAP is the review of the national sanitation, environmental sanitation and hygiene policy by the Ministry of Health, that then now brought on board aspects of urban sanitation, aspects of transportation that were resting in different ministries. So this policy then kind of tried to harmonize. They play a critical role. And then secondly, if you are going to engage in urban sanitation service delivery as a private sector, there are issues of licensing, which had been a stumbling block. because the public sector felt that it's within their domain. Again, the policies did not address this quite well. So there was a whole lot of red tape to deal with before the private sector would get licensing for this. And part of our marketing strategy was to target regulations that are there in terms of licensing the private sector to come on board. And I think in many deliberations that we did to bring them together, private sector did come out strongly that they are interested in engaging in sanitation. So as we were developing the concept, we knew that there is potential to involve the private sector, especially with respect to emptying. That's where they had the strong an edge. And then there was also the question of the suppliers for materials and the artisans that we train, because the artisans we train are not employed by the utilities. They are not, neither are they employed by the trust fund, but they are people who are skilled in masonry and they would want to make a living out of that. And they happen to be locals in the areas we target. So there was really an open market for the private sector to come in. What we needed to do was to see how can policy support them, strengthen their, their participation in bridging the gap, sanitation improvement gap.
Okay, thanks so much. There's a question from Asi Takba. He asked, what should be the right point of beginning when dealing with sanitation marketing? And I'd like to combine that with Tyler's question. As market saturation is becoming a bigger issue in Cambodia, have you begun to experiment more with smart subsidies or subsidized financing options to reach the late adopters at the very base of the pyramid?
Both great questions. I mean, I think when we think about the right point of beginning when we're thinking about sanitation marketing, we really try to think like a business. So figuring out, what are the market conditions on the ground? First of all, what are the kind of coverage levels, to get to Taylor's question, especially because we work in rural areas, thinking about things like population density, difficulties in transportation, and then figuring out what are the products that are already available and what are people accustomed to buying. So in the case of a place like Ghana, where we've just started working, there were really very few products on the market, and it was the supply chain was really fragmented. It was very difficult for people to kind of buy everything in one place. So that's one of the big value adds that IDE and our sanitation marketing model brings to the market, is really being able to to bring the latrine purchase into one transaction. So thinking about things like market conditions, existing products, existing supply chain, it's the same kinds of things that a business thinks about. I think the second question, I almost wish I would have planted that question, but I didn't. It's a really great question. In Cambodia, we've actually started to do some really great work, I think, with smart subsidies and financing. We've gotten some initial results from those studies. So we ran a randomized control trial looking at the impact of smart subsidies on the uptake specifically of poor households, but also looking at non-poor households. And what we found is that smart subsidies are a really great way to increase uptake among poor households, and to really drive sanitation coverage in poorer parts of the country. So the kind of caveat to that is that in Cambodia there's a really unique, I don't know if it's unique, but it's a system where it's very easy to kind of tell who qualifies for a subsidy and who doesn't. So we're able to very easily target where those subsidy funds go. So I think, as I said, the overall kind of takeaway from that is I think there's a lot of promise in smart subsidies. The financing for us is a little bit more difficult. It's been I think it's been difficult finding microfinance institutions and other finance institutions that kind of understand the sanitation market and that are willing to take the risk to dive into that market, even on a small scale. So as an organization, we're kind of figuring out what are the trade-offs and what makes it worth it for us to think about, working with finance institutions or potentially thinking about bringing some of those finance components in-house. That's something that's a little more in the works. But I think the smart subsidy stuff, over the next couple of months, I think we'll put out some. I just think some interesting conversation starters about the potential for smart subsidies really to drive uptake, especially as Tyler said, as you get to some of those late adopters and base of pyramid customers for latrines.
Okay. Okay, I have one more question that I would like to pose to Simon. How is the cost recovery for the treatment plants, and who ultimately pays for the operation and maintenance of the infrastructure? Yeah, the infrastructure of the decentralized treatment facilities that you were talking about.
Thank you, Doreen. Yeah, remember the treatment plant is fully financed by the Water Services Trust Fund. So this through a grant to the water service provider. However, the motive for establishing that is looking beyond just constructing a facility. We are looking at how do they operate that facility sustainably. How do that facility ensure that there is complete service delivery, sanitation service delivery, and that then brings the question of can this facility run by itself without involving the households to make payment for for the service that they get when their facilities are emptied. So we've looked at the program has looked at the whole financing model across the sanitation value chain, and it's not one single option that runs the facility. We have given several other options. One option is that the utility, if the water service provider has an exhauster, because a treatment plant will only work if there is the front end, that is the toilet. Without a toilet, the treatment work serves no purpose. And so one aspect of even the sanitation marketing is approach the households and telling them about the operations of their facility. That is, for their facility to be long-term, to last long, to serve them better in a clean environment, they have to do emptying, and there has to be a fee for emptying. This fee either goes to the private exhauster or the private sanitation team that has been formed through the program, or it goes still to the utility if the utility has an exhauster, so that the utility then transports either the private sector or the utility or the sanitation team transport the sludge to the treatment work. Where the utility does that, obviously they will have an operator situated there with whom will be handling the issues of disposal. And so this is a whole business chain that is built on the water utility. Where we have the private sector, the emptying activities are arrangements that are done privately between the household and the private exhauster. But the private exhauster will definitely have to access the treatment facility owned by the water utility. So it means at the entrance to start disposal, the private exhauster will have to pay a fee to the water utility or to the operator stationed there by the water utility in order to dispose of the sludge. Now that's one stream. We have had cases where there is a blend of two. Private exhausters operate in the same environment as the utility exhauster operating in that. And so we have split the operation again in the same manner. Another last model is where the utility franchise out the entire treatment plant to a private operator with exhausters. So the utility will simply be getting some monthly fee or generated from treatment from the from franchisee who is operating the facility. So those are all models that we've crafted around the concept of emptying, transportation and the deposition of sludge in the treatment work.
Okay, great. Thanks so much. I think we've really run out of time. Thank you so much to the two presenters, Greg and Simon. Those were very interesting presentations. just some information to the participants for the questions that have not been answered. I apologize for that, but we've completely run out of time. All the questions will be uploaded in the discussion forum in the link that I sent to you earlier. And I will ask both Simon and Greg to answer them, and then I will alert all of you once they've been answered by the two presenters. I'd like to take this opportunity to thank Greg again and Simon for a very interesting presentation. Okay. Thank you very much. If you still have some questions, you can still write them down in the chat section, and I'll take them together with the other questions that have not been answered. Thank you very much, everyone.